To another Facebook and YouTube Live. This is the first of 2022, and it's took about a 3-month hiatus, and so it's kind of glad that it's good to be back and just to kind of get back in the groove and just kind of begin as we look at a new year, new beginnings, and a lot of things that we can kind of begin to kind of prepare for what's ahead, especially with NexGen NCLEX, and even just overall just strengthening how we prepare our students for practice. If you've never met me before, my name is Keith. I'm the founder of Keith RN, an innovative resource that just provide practical and practice-based strategies to just bring clinical realities into the classroom, into the clinical for nursing students. And, kind of if I could just accomplish one thing with my journey in nursing education and with what I do to serve the needs of nurse educators, it's just to change the paradigm of this focus that really has been exacerbated now with NexGen NCLEX, but preparing for NCLEX success. And we need to counterbalance that with practice success and really preparing students for real world clinical practice. And one of my strengths as a nurse educator is that I never left the bedside of patient care. I've been at the bedside for 36 years and really is my passion, and had a Baylor weekend position. So I was able to kind of do both, have the weekends in practice and then teach during the school week. But what I want to do, this is not about me, this is about you. And I just want to welcome those that are joining us live tonight. And so if you are out there, I'm coming to you live from Minnesota in the Twin Cities area. It is cold. It's about 5 below zero without the wind chill. So that is frigid. So if you are blessed to be above zero, you're doing well. So let me know who's out there tonight. Just kind of throw your name in the chat, where you're from, and I hope that you are just warmer than I am. I've got my little space heater here in my home office, and so I kind of, with all the windows even, it just kind of radiates the cold. And so just let me know who's out there tonight. I'd love to just kind of say hello and welcome. And as we look at a new year, it's a new beginning, like I shared. And, we always talk about resolutions this time of year. And, just an introductory thought is I'd like to contrast resolutions versus resolve. Resolving to do something is a little bit different than a resolution, and there's some nuanced differences. And, as we look at a resolution, it's really more of a decision to do something or behave in a certain manner. But a resolve is deciding firmly on a course of action to find a solution to a problem. And, as you look at your journey in nursing education, I'd love to know, just kind of put in the chat, what are your resolves for 2022? We can all want to lose weight. We can hopefully, and exercise and do those traditional things. But when it comes to nursing education, I'd love to start this Facebook chat, this YouTube chat, with what is it that you are wanting to resolve, making a firm decision to do differently in your teaching and in your life. And so, would just give you, there's always about a 30-second delay or so. And so I'm gonna give you some time. And Jane, what a pleasure to have an old colleague from St. Cloud State. You're also cold, about 60 miles north of us here in the Anoka area. So great to have you with me tonight. And Dixie in Nebraska, and Joyce in snowy Steubenville, Ohio. And there's others out there as well. But, I'll just share my journey here first for just a moment, because, there's some things that I want to do better. And that is really putting first things first. And, I've been on this journey helping educators for the last 10 years with Keith RN and just serving the needs of nurse educators. But you know what? I am a type A driven dude. I kind of tend to just get very focused, and I put other things ahead of what's most important. And, as you look at life, what's really more important? The urgent things of your work, what you need to do, or is it your relationships with your spouse, your significant others, your children that don't always demand that attention? And I'll just be really honest, there's been times that I have failed to really be present at times to my family, to my spouse. We were married at the age of 18 for 40 plus years now, just this year. And, our relationship has struggled. But, I want to share kind of what happened over this last 3-month break is that I have something to celebrate. We had a vow renewal. We did a lot of work and some couples counseling, worked through some of our struggles. And, I can just tell you that I am just humbled and blessed to have really a restored, in many ways, relationship. And I'm really determined not to go back. I'm going to burn some of those ships of really making even Keith RN more important than the things that I should be putting first. And so I'm going to find some balance. It's hard for me. But, that's more of a personal, but it's very important to me. And I just want you to know that, my wife is, just really, 5 children and 6 grandchildren, a wonderful mother. I just want to honor her and let you know that behind every man, there's a better woman. And I wouldn't be here with Keith RN if it wasn't for what she has done to support me with my master's. When we had 5 kids still in school, she was doing it all. And now the PhD in the last couple of years. And so thank you, Rhonda. I appreciate and love you very much. And so anyways, don't want to get too off topic, but just wanted to share that. And so if any of you have got anything that you want to resolve differently in your journey, I'd love to hear it. And you can share that in the chat. I'll keep the chat open. I just want you to know that these Facebook Lives reside, we'll do this about 30 to 45 minutes, depending on the interaction. They reside on my YouTube channel, Think Like a Nurse, as well as the Facebook group, the Facebook channel that I have, Keith RN, Think Like a Nurse. I also have a Facebook group for nurse educators that I'm blessed to be the admin for. It's almost 10,000 educators strong, called Teachers Transforming Nursing Education. If you go to Facebook and just search that, it's a closed group, but you know what? It's a supportive community, and I'd love to have you be a part of that. And, just ask any question. I do as much as I can with my schedule and respond, but you've got thousands of other educators. Any challenge, sharing tools. It's a wonderful community. And so just want you to know that it's out there. But today's topic, let's get to business. Holistic clinical judgment. It's kind of a term that I coined, but it's something that as a nursing education, we look at, developing clinical judgment and the importance and the centrality of that. We look at nursing. What makes nursing distinct? It's holistic patient care. What does that look like? What does that mean? Well, as we know, it's not just taking care of the body. It's basically not just being a technician. It's basically being intuitive and recognizing that as a human being, we have an emotional component, a physical component, and a spiritual component to our being. That's what makes us distinct and unique from all other creation. Therefore, a good nurse and what holistic nursing practice does, we take care of all three. And with clinical judgment, it's not any different. When you look at holistic clinical judgment, there's really 3 pillars or foundation that we must develop in our students, or they'll be stunted. They will kind of be a technician of clinical judgment. They won't have that holistic approach that's needed. In nursing education, we can begin to move that chain, and we can really develop holistically. And those 3 components are quite simple. It is caring, critical thinking, and clinical reasoning. Clinical judgment is the 4th C. Ironically, they all begin with C: caring, critical thinking, and clinical reasoning. But the bottom line is that they lead to the outcome of a clinical judgment. But we need to define these terms, because caring is kind of what I've noticed in my journey as a nurse educator. We can talk about caring in our programs, in our mission statements, in our handbook of ours that we give our students, but it's not in the curriculum. I'm going to share some observations why caring needs to be the foundation, and how caring behaviors must be cultivated and nurtured and encouraged in our students, which, as we know, it can be a challenge because, we have the pandemic, we have a lack of clinical hours, we have simulated settings, but I'm going to share some practical strategies that I've developed in my journey to really help us develop the caring. But before we go there, we must define each of these terms concisely for you. So let me share the definition of caring from Dr. Patricia Benner and her work. And she wrote in Primacy of Caring back in 1989 this beautiful definition. The essence of caring as a nurse is that you recognize the value and worth of those you care for, and the patient and their experience matter to you. You see that patient not as just a patient, but as a person of inherent value, dignity, and worth as a nurse. And in essence, that person matters to you. They be a stranger. It's kind of like the Good Samaritan. That wounded person in the ditch in the parable that Jesus told was a stranger. The Samaritan had no vested interest in him, but yet he saw, he noticed, and he cared. And so I really love Dr. Benner's definition of caring, because this definition needs to be held before our students and I'm going to share some strategies how we can encourage and cultivate this caring behaviors in our clinical settings, for example, with some practical strategies. So stay tuned. As we look at the other C of critical thinking, critical thinking has multiple definitions, but the essence of it is the ability of your students to think clearly, precisely, and accurately, and to act on what they know and understand about the content. This is from Potter and Perry's Fundamentals of Nursing. So it's not it's pretty straightforward, but what I really want us to grasp as educators, and I've shared this many times, but it's always worth repeating. It's not what your students can memorize to pass the test. It's what do they understand about the content? Do they deeply understand what's most important so they can apply it and translate it to the bedside of patient care? And critical thinking takes place primarily in our classrooms. So when we're teaching, it's high stakes. We're making sure our students understand essential content. It's the second component of clinical judgment. This is why we can't have infobesity, TMI, covering the content and just rushing through 60 slides an hour, going through everything and just expecting our students to they're unable to retain it. They can memorize it barely, but they don't remember it deeply enough because we're giving them too much, and we have to filter that. And I've talked about that, and we're not going to go there tonight, but I do want us to get a grasp as educators to teach holistic clinical judgment. It starts with caring, living that out as educators before our students. We role model it, but then we need to be teaching differently. We need to teach less so that they can retain more. Then clinical reasoning. Now, this is different than critical thinking because, as I've shared from Dr. Benner's work from Educating Nurses, she has a beautiful definition of clinical reasoning. It takes place at the bedside. It's the thinking in action and reasoning in the moment of providing patient care and recognizing when that situation changes. And so clinical reasoning skills, we have to first have critical thinking, though. They have to understand and know content so that they know, for example, pathophysiology. They can recognize the significance of an elevated temperature, a heart rate that's trending upwards, and a blood pressure that's going downwards if that patient's sliding into shock of any kind. And so, in essence, the clinical reasoning is making those moments in the presence, understanding the significance of trends of clinical data. What is my priority? Anticipating and recognizing problems as they present at the bedside. That is the essence of clinical reasoning. That skill needs to be practiced repeatedly. And with the clinical reasoning case studies that I've written, from my lens of clinical practice, I really situate those principles. And so I just want us to be very clear that as educators, we need to do all three. We've got to teach the caring, role model it, the critical thinking of information and having that essence of what's most important, and then the reasoning with it at the bedside. And then the clinical judgment that we're all focused on, NexGen and everything else that it represents. And it is a big deal because the majority of our students don't graduate with clinical judgment skills. A recent study, Kavanaugh, in 2021 in the Cleveland Clinic, in that system in the Midwest, 9% of graduate nurses are meeting entry-level expectations of clinical decision-making. We're struggling big time. And I know the pandemic and all the things that are against us as educators, but, I just want to kind of highlight that. And so, yeah, I think Barry commented, think like a nurse, to role model it, teach less and act more, thinking in action. And I agree, Barry. And, I really want us to get a vision as educators. If we're skills lab educators, we're teaching sterile technique or skills in the clinical, we expect our students to practice over and over again. And, we have to develop the clinical judgment skills that our students must possess for safe practice, as well as for the NCLEX. Our clinical judgment needs to be practiced with case studies and practice-based scenarios and opportunities, videos, be creative. But, and that's a lot of things I've already talked about in prior Facebooks and all that I do with Keith RN. But we must remember this. It's not just one and done, like doing a simulation once or twice a semester. We need to bring low fidelity simulations, case studies that represent practice realities, even if it's for 10 or 15 minutes, to our classrooms. Hopefully, the majority of times that we teach, we have to practice the thinking and action skill of clinical reasoning so our students can then translate that to the bedside of patient care. Now, I want to share with you a must-read article. So I'm going to pop it in the link, or pop it in the chat right now. And it's Chris Tanner's Thinking Like a Nurse, a research-based model of clinical judgment. We're focusing on NexGen NCLEX. It's got 6 steps, as we know, and many of us know what those 6 steps are. But you know what? The NexGen model is an evaluation test model. It's not meant to inform practice. There's no research to support it, so we shouldn't be teaching our students that. But Tanner's framework in the nursing literature, it's 15 now going on 16 years. It's a practice-based, evidence-based, research-based framework of clinical judgment, where Chris Tanner, a preeminent educator, basically took almost 200 nursing studies on clinical judgment, synthesized the findings, and identified 4 reasoning processes, clinical reasoning processes that lead to the outcome of judgment. And those 4 steps are in this article. And this one, I think, is a PDF you can download right off the internet. But the first one is noticing. What are you noticing as you look at that, as you review the clinical chart, the patient assessment, the interpreting skill of what does it mean? Then responding with the plan of care. What is you going to do with your, basic plan of care with the priority interventions, et cetera? And then reflecting, evaluative reflecting. What happened? Did the patient respond as expected? And these 4 aspects of clinical reasoning dovetail with the nursing process. And so it's really a valuable model that helps us to really understand the essence of clinical reasoning. So my goal is to give you an overview of all 3, because as educators, we need to develop and teach all 3. But I'm going to focus on the caring here in just a moment. But when we look at clinical judgment, I love Florence Nightingale's observation 150 years ago in Notes on Nursing. She had this statement that that jumped out at me. She said this. Let me just put this on the screen because it's worth showing to you all. Observations and their interpretation are hallmarks of trained nursing practice. Clinical decision making, though we sometimes, it's always been there, but when we look at the essence of what it means, Nightingale identified the importance of the 2 steps of Tanner's framework that Tanner identified 100 plus years later, the importance of noticing, which is the first process of Tanner's framework, as well as assessment of nursing process, they correlate, observations, and interpretation. What does it mean? Then that's going to guide how you respond. You see, it's a dominoes. And so again, if we're teaching Tanner's framework and the NexGen is then testing those processes, we're going to prepare our students for both practice and NexGen. But I just wanted to bring up that Nightingale also kind of saw that and recognized the importance of that. So I just, as we look at clinical judgment. But as we look at Tanner's, the reason I wanted to bring out Tanner's for just a moment is that Tanner's clinical judgment model, again, it's a practice-based framework that has a number of what Tanner identified as assumptions or conclusions about clinical judgment. This is the strength of a practice-based framework to really guide your curriculum. And as a theoretical framework, it must be embraced as something that should be considered in your curriculum as a guiding framework, because the very first process of Tanner's framework talks about the importance of what the nurse brings with her caring or his caring and engagement and how that influences clinical judgment. This is the first assumption. Clinical judgments made by the nurse are more influenced by what nurses bring to the situation, what they possess, what they have here for knowledge, what they possess with their prior experience, and what they possess with their caring and their engagement with the patient, their love for nursing and patient care. That is more important than the objective data about the situation at hand. And this is what I'm afraid of as we're hyper-focused on NexGen NCLEX, the 6 steps, and just drilling those in our students, having them in our classrooms, and we have all the 6 steps. We're reinforcing those 6 steps every step of the way in our program with our case studies. And again, we can simplify it with Tanner, and that's kind of what I've done with my cases. But the bottom line is, the data in those cases, yes, that is part of it, and we must understand and notice and interpret that data. But what we're forgetting, I think, as nurse educators, because of our focus, we're losing sight that nurse needs to possess a lens of caring, compassion, engagement with the patient to interpret the data accurately, not to blow it off. I'm an ER nurse. If I make a judgment about a patient, just another drug seeker, oh, it's a frequent flyer, not him again. Am I going to be engaged? Well, I basically notice. I'm just going to be irritated. And if we're burned out in practice, the pandemic is taking a devastating toll on healthcare workers, on nurses, on students who are now entering practice. If that burnout happens, that is going to be a problem. And Tanner's framework talked about that. It's what you possess here that influences what you think here. And as nurse educators, this is why Tanner's framework, again, has such incredible value. The NexGen framework is a test model. It's a test framework. It doesn't have this depth to guide and inform the curriculum and how we should teach nursing to develop these behaviors in our student. The second assumption I'm just going to highlight, and I'm going to move on, is really also very interesting because she had 5 of them. And so if you download that article link that I shared with you, let me just, we'll show it. I think I'm going too quickly. My technology is a little slow. There we go. Number 2, sound clinical judgment is based on knowing the patient and their responses, as well as engagement with the patient and empathizing with their concerns, really providing patient-centered care. This is where QSIN, we've embraced QSIN, but let's really drill deep on patient-centered care in CUSIN, because that really gets to the heart of the importance of caring, engagement, and just focusing on the patient as the priority and what that looks like. And so again, Tanner's framework can help guide and inform that for our students. And so let's embrace that and kind of bring these assumptions into our practice. I want to share a couple of research articles that I think you'll find really interesting. So these are, I would love to see you just put these, download these. These links are here for you to put to use. And so let me just go there. This is an article, 2013, a little dated, but still very relevant. It's called "The Effect of Caring Behaviors on Their Disposition Towards Critical Thinking of Nursing Students." Now, this is a really interesting article because what they had as an assumption for this research article or research study was that emotions, the caring behaviors of the nurse, influence how the data is interpreted. And what they found out is that when they did a couple of different inventories of a caring inventory and a critical thinking inventory. When they looked at the integration between critical thinking scores and how they scored with their caring behaviors that were measured by another instrument, that there was a significance of P001. So that's off the charts, between caring and a disposition to critical thinking. And what they found out was that critical thinking can be predicted by the amount of caring behaviors a nurse possesses. And one of their recommendations was this: nursing education should emphasize a curriculum related to caring behaviors to improve the disposition of critical thinking in nursing students. And this kind of gets me to the next point, is that how are you integrating caring in your curriculum? I want you to put something in the chat. Are you doing it? When you look at how are you expecting it, how are you intentionalizing CUSIN and patient-centered care and making it real, making it stick, like Dr. Benner said in Educating Nurses 11 years ago. We need to contextualize the content that we teach to the bedside of patient care. And so, as you look at your program in clinical, for example, which is really where the rubber meets the road, how are you bringing that caring integration into your clinical as well as in your curriculum? So I'd love to get your thoughts on that. And if you have anything to share, I'll keep my chat open and would love to get your feedback, because I want this to be a dialogue. I've got my preparation, I've got my thoughts here as I've shared, but I want to know what you are doing out there in different parts of the nation as it relates, what we can learn from, because really, at the end of the day, this is a community. And it's a dialogue as much as we can by Zoom and a Facebook Live, but I've got the chat. And so really would just love to get a sense as far as what are you doing to help bring this into your content. Let me share a couple of strategies while I wait for some comments that I would love you guys to consider. When you look at caring questions, and I apologize for, let me just see if I can get these in my, I'll put these on the screen here quick. I can do this with my technology, which is kind of nice. So let me just pop that in, and I am going to share that. What is the patient likely experiencing or feeling right now in this situation? When I was a clinical instructor, even when I was at St. Cloud State, Jane, I would ask my student this question every clinical. What are they feeling and experiencing right now? Because what this gets to is the essence of empathy. What is their lived experience right now as a patient, and as a nurse? To promote that engagement, we basically need to we need to get into that reality, and we need to kind of identify with it. And so by asking the right questions, just as we ask thinking questions, why is their blood pressure this? Or what would you do if? We all have our critical thinking questions and clinical reasoning questions. Do you have caring questions? You have my permission to use this question in your clinical as just a practical way to bring caring and bringing it to the forefront. Talk about this in post-conference. This makes a great, instead of just the blah, blah, blah of your day, sometimes it gets a little dry. Got to mix it up. Let's talk about caring. Let's prepare them and let's expect that we're going to integrate these questions in our clinical paperwork. Let's talk about it as we basically, as part of our routine. And so again, just look at what you can do to just do some things differently. And let me just share a second question that really takes Dr. Benner's definition of caring and makes it a question. What can you do to engage yourself with this patient's experience and show that they matter to you as a person? Remember that aspect of Dr. Benner's definition? What are you going to do today in clinical to engage with the patient's experience and show that they matter to you as a person? And then have some caring interventions. Have your students think about one or two things they could do with this patient based on their history, on their story, on their age, that would bring that context, to the patient. And so, again, these two questions I've used in my clinical setting. I've used in my case studies, even that I've written. I integrate those caring, holistic questions. And so I would encourage you to do the same. I want to share one other kind of another caring intervention you can do in your clinical, even in your curriculum. And I'm going to share some links here in closing here in just a few minutes, but it's taking Kristen Swanson and her middle range theory of caring. And let me just put this in the chat because this is a very powerful framework of caring. This is kind of a summary of Kristen Swanson's middle range theory of caring. But what Kristen Swanson did 30 years ago, she was doing her PhD work. She's an OB educator. And she was doing her dissertation, doing some qualitative research with identifying the themes of mothers who lost their baby. Their baby died, their baby was stillborn, or their baby was in the NICU, critically ill. And she just simply asked this simple question: what did the nurse do to show that they cared? Asking from a patient's perspective, what did that nurse do that communicated caring? So the power of Swanson's framework is that it's middle range because it derived from practice, but it basically identified the patient's perspective. And so she identified 5 themes. I'm just going to share a couple of them with you. And she identified some caring interventions that the nurse did that we all as educators can learn from and integrate this into our clinical setting. And I've got a link I'm going to share on my website that kind of makes that practical. But the very first theme that Swanson identified with these women was knowing. The knowing theme really is about empathetic understanding, that empathy is communicated very intentionally to the patient. And, one of the interventions that Swanson identified was this: avoiding assumptions communicates caring. That's a judgment. Let's be honest, we're human. We're all going to make assumptions and judgments more than we'd like. And many times they're not accurate. And if we can avoid assumptions or making judgments about our patients, about the frequent flyers, about the difficult patients and families, we will communicate caring. Because when a patient doesn't feel judged, they feel that care. They feel that love. And it's like it's authentic and it's tangible. And so we have to teach our students, some who can be a little bit judgmental on themselves or others, the importance of avoiding assumptions. Sometimes your students are going to get a loaded report in clinical. That nurse in the handoff report's going to say, this patient is a blah, blah, blah. You're going to have the worst shift of your life. Good luck. He was so inappropriate, blah, blah, blah. Okay. Are you going to make those assumptions your own? Or are you going to wipe the slate clean and make your own assumptions? Many times it's a personality conflict, not always the patient. So again, that's a practical skill. Another one thing we can do with communicating caring is being with, and that is just being emotionally present. We're so busy, we got multiple patients in practice. It's not always easy to do. But really, the power of the intervention that came with this theme was conveying availability. Now, you're conveying to that patient, I'm available to you if you need me. It can be as simple as just kind of, here's the call light. Don't hesitate to use it. I'm available to care for you anytime if you need something. Those little things are big things, but we can teach our students some of these caring interventions. And so I just want us to be aware of some of these resources and these approaches that I think can really be transformative. And I want to share something that's on my website, Keith RN. I'm just going to share this in the link because what I did, and I did this at St. Cloud State as well, was in essence, I was able to use Kristen Swanson's framework. And I was able to, unfortunately, I'm not able to copy, and my link doesn't want to copy and paste. That's frustrating. There we go, finally. Thank you, Lord. Here we go. Let me pop this in the chart, because on my website, Keith RN, I've got a link called Can Caring Be Taught? That's $1 million question. And every one of us, that'd be a great, I'd love any thoughts or comments on that while we're talking about that. But, can you teach caring? Is it within you, or is it something that can be learned, or learned behaviors might be a better approach? And I would say that yes, we can teach the caring behaviors and the interventions that a nurse can do that communicates caring. It's Kristen Swanson's framework. I used this before I came to St. Cloud back in over 10, 12 years ago at another program. But in essence, there are 5 clinicals that in the fundamental clinical. I recommend this at the first year for any student. There were 5 processes of Swanson's framework. There were 3 to 5 caring interventions. And so I had my students took 1 process a week. I taught a little bit about Swanson, had some little simple handouts, a PowerPoint, and other information. That's all in the bundle, by the way. Look at that website, and that's a free download. I want you to have that. And the bottom line is that the students came to clinical with their traditional care plan, their clinical paperwork, but they came to clinical with a plan of caring. Using one of Swanson's processes for that week, they identified 1 or 2 interventions they would do that were caring based on that theme. They'd evaluate how the patient responded, and then they'd submit it. And it was just part of this, just a simple 1-page assignment. But my students really found that a meaningful activity, both at St. Cloud State and at Anoka Ramsey Community College in Coon Rapids, where I taught before then. And so, there are just little things that we can do in the curriculum. And using some of the theoretical frameworks like Kristen Swanson's middle range theory of caring, using some of the things I've suggested from Dr. Benner's lifetime legacy of incredible work to better our profession and how we teach it. And so really my passion is to make these things practical and available to you as an educator. And so I just want you to know that that's available to you and would encourage you to put that to use. I also want to share one more link with you. And that is something that is a brand new resource that I've written. And I want you to know that back in 2015, I wrote the 2nd volume of Think Like a Nurse, Practical Preparation for Professional Practice. I talked and had a whole chapter on why holistic care is the foundation of nursing practice. And what I've done recently, it's been 6 years since I updated the 2nd edition. I've taken my PhD knowledge. I've taken just what I've learned and grown as an educator and as a person. And I basically have currently revised and rewritten the 2nd edition into a complete rewrite of the 3rd edition that has 3 separate volumes that are about 150 pages. But these volumes correlate with the 3 components of holistic Clinical Judgment. The first book is on laying the foundation for professional practice. We're talking about caring, professional behavior, and even incivility, the elephant in the room, unfortunately, all too present in academia as well as practice settings, and practical strategies for student success. So it's the 75% of that content is new from the second edition. I have a second volume coming on developing the knowledge for professional practice. Again, pathophysiology, looking at the fluids and electrolytes, looking at a physical assessment that's practice-based, and how to do a systematic head-to-toe when you only have 3 to 5 minutes like we do in real-world practice. And so, again, just developing the knowledge base is volume 2, and volume 3 is developing clinical judgment skills for professional practice. And that goes all over Tanner's framework, the different noticing skills of clinical reasoning. And so that's going to be published in March of this year. But I just want you to know that this link, I've got some free opt-ins. I've got the first manuscript just laid out. I've taken excerpts and the first chapter and some other resources from the first volume I want to share with you. And so if you download that, you'll get the ability to get updates on when the second volume and the third volume will be available, pre-publication discounts. And so I just want you to know that what I notice is that students get a lot of test questions, but we don't have kind of a concise kind of information for our students to really understand the holistic aspect of clinical judgment. And so it's really my passion just to share what I've learned and as a nurse in practice, as well as, to empower educators to develop all aspects of caring, critical thinking, and clinical reasoning skills. And so again, that's just a resource that you're welcome to take a look at. And again, that landing page has more information plus an opportunity to sign in. And so I just want you to know that resource is available for you. And so, if you have any further questions, or if you kind of want to learn more about what I'm doing with Keith RN, if you're kind of new to what I'm doing, I just want you to know that every month I have a free webinar for 2 hours. And I have one tomorrow from 10 a.m. Central to noon. It's a Zoom webinar, and I'm just going to share, just going over all of the tools, highlighting the tools, the case studies, walking through some of the different resources that I've developed that educators are using all across the country to practice clinical judgment, clinical reasoning skills, and the knowledge, and kind of putting your lecture on a diet with infobesity. And I'm going to go over it all: clinical, classroom, simulation, even evaluation, and test item writing, just briefly. But I've got resources in my all-inclusive membership, Think Like a Nurse. And so that's another resource that's available to educators that programs all around the country are using. And it's got about 110 unfolding reasoning case studies and other tools and resources. And so if you're interested to learn more, that's the informational page for the membership. I have both individual and departmental memberships at a discount. And so again, it's really my passion to really just strengthen not only how nursing is taught, but, as a nurse in practice, as well as a rapid response nurse. I saw firsthand the consequences when a nurse fails to think like a nurse. And I've seen at least 2 patients die as a result of a problem being recognized until it was too late, and the code wasn't going to resuscitate them, and they died. And, failure to rescue is a real problem. And I really want us to recognize as educators that, yes, we got NexGen breathing down our necks, and we've got to be prepared for that. But you know what? The failure to develop clinical judgment skills doesn't affect just their NCLEX success rate. It affects patient outcomes and can also cause patient death. And so really, as a nurse who's seen that firsthand and has really just been, I want to be a part of the change. And so really, I'm really about a movement to really empower us as educators, provide you with the tools you need. It's not about a business for me. That's the last thing on my mind. I want to really create an opportunity for educators to simply be a part of the needed change that most of us, I think, recognize. We got so many challenges, and many of them aren't our fault. But we've got to recognize that we've got to do our part to graduate practice-ready nurses. And despite the challenges, we owe it to them to do the best we can. It's all we can do. And it's my passion to help you and empower you to do that. So I just want to thank you for just taking time out of your busy schedule this evening to kind of to be with me tonight. And I hope you found this helpful. And this link will be on my YouTube channel, Think Like a Nurse. You can go to that, subscribe, or you can basically share this link, as well as on my Keith RN Facebook page. I just want to thank you for joining me tonight. I appreciate each of you, and I value the opportunity to partner with you. And so if any of you have any questions, I will just basically, I don't see any questions, just some comments. Jane, so exciting. Keith, yeah, we got to connect, Jane. I hope you shoot me an email. In fact, what I'll share in closing here for any of you is that I am always available to anyone who has a question or challenge. And so if you if you'd like to connect and have anything you'd like to share, just contact me, Keith at keithrn.com, and I will give you a response and give you my best thoughts just to guide you and to be available to you to kind of get you unstuck if I'm able to. I don't know it all, but I do know clinical judgment, and it's my passion, and it's with my PhD studies. I did a dissertation on the topic, so I feel like I've got that knowledge base as well as from the practice base. So anyways, thank you again. We'll see you in 2 weeks, and I appreciate all of you and all that you're doing to be part of the needed change. And yes, Patsy, I am coming to Georgia in February 17th. And so I don't have the link for that, but that's a Georgia conference. And Shirley Wolf, good to see you again. And Shirley, yeah, thank you, Keith. I appreciate that. And Dixie, thank you for the comment. Just take this information, and I hope you put it to good use. If you have questions as you download, or just questions about what maybe you didn't get a chance to ask this, please go ahead and do so. And Jamie asked if there'll be a new text for the faculty. Jamie, I've got some new stuff coming for faculty. I'm going to be a little bit more innovative and have an online resource that will be very different than a textbook, but will empower faculty to teach differently, and we'll be able to deliver it probably in more like an online LMS format. And so I'm not going to say more than that. It's kind of on the back burner right now, but it will be coming. And so I just want you to know that, Jamie, yes and no, not a textbook, but an online textbook that will be much more than an online textbook. It won't be even similar. And so just a heads up on that. So anyways, thank you so much, and blessings to you all. And thank you again. Have a good night. Take care.